Hey everyone, welcome back. My name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today's a really special episode because we're going to be talking about spacers. And if your child has ever used one, has something like reactive airway disease or asthma, then you might be familiar with using a spacer. I'll demonstrate today in this video and answer your most common questions. A spacer, otherwise known as a metered dose inhaler, actually has three parts, and I have a pediatric spacer and an adult spacer here. Now these are both ones that we've used in our own homes, and I'm going to talk you through the different aspects of it. A mouthpiece, which is right here, the cap, which goes over the mouthpiece, and then the actual canister where the medicine goes. Now to demonstrate, I actually have an inhaler here, and we're going to talk about how that actually fits into the spacer. So you can see that it actually fits in just like this, okay? And that's actually the setup. We'll talk later about how to prime the medicine before it goes in the spacer. First of all, let's talk about why spacers are important. When the medicine goes in here, it actually fractionates and breaks apart the medicine into smaller particles, and it helps to make sure the medicine goes deeper into the lungs because you actually inhale around this mouthpiece. Versus back in the day, we used to actually put this medicine straight into the mouth with the canister, and that would actually end up having a lot of the medicine deposited in the back of the throat and not going deep into the lungs where it should be going. Is it really better to use a spacer? Honestly, I think so. Yes. You're going to ask most pulmonologists, most allergists, they're going to tell you yes, because the medicine is just so much more effective when it goes in the place that it's supposed to go. It's very important that this is not just any type of medicine that you just take through a syringe or take via teaspoon or take via cup. It goes down the throat and it goes into the stomach. This medicine is all about the technique. So the spacer, it really depends on if your child's old enough to use it. Spacers come in all different sizes and shapes, which I've demonstrated. So this is actually the smallest face mask. We have another one that goes up. I think it's the medium face mask, and then there's a larger face mask as well before you graduate to this. But you can definitely ask your clinician or your pharmacist about what the better fit is, but you're going to want this for a child's mouth to be where the nose fits, and then it comes around and is very tightly shaped. So obviously this is not shaped for my face, but for a smaller child, yes. Now, typically, I don't start a spacer until they're at least 3 to 5 years of age, and there's a huge range in there because not all 3-year-olds are mature enough to be able to use this. For example, if you breathe in too fast, you might hear a whistling sound, and some children, like my daughter, thinks it's hilarious when she tries my spacer out and she hears that sound. But I obviously know that that's not an effective way, and she's obviously doing the wrong technique. That's why we always do something with a face mask for her. All right, so what is the technique? Well, first off, you're going to get ready. That involves priming the medication. So you shake it about 10 to 15 times because there's an expellant that helps the medicine get out, and then there's the actual medicine, a few other components as well, but you want to make sure that's evenly dispersed so you're actually getting medicine and not just hearing it puff from the expellant. Now, because this is a new one, I'm actually going to have to prime it a few times, and I'll show you how I know that. So you see how you can't see any count there? This is a brand new one. I'm going to prime it and I'm going to show you the count. Okay, there we go. Now take a look. 200. So there's 200 doses still left in here. That's really helpful to know because you need to keep an eye on this every time you use the medicine. If you get down to like, I don't know, the last 20 puffs, depending on how frequently you're using this, if this is just a 2-puff a day medicine, then you're going to want to make sure you reach out to your pharmacy in time. Don't wait for it to run out. So this counter counts down, and you'll see towards the end of the video, I'll show it to you again, you'll see there's less doses in it. First thing we're going to do, we're going to attach it, and I'll do it for the pediatric one just for demonstration purposes. You're going to actually attach it in. Now typically you're going to put the spacer between your teeth and close your lips tightly around it. Children cannot do that. So you're going to actually be putting their nose and their mouth in and then forming a tight seal. So I'll show a video about how I do this for my child, but I actually kind of come around her and sort of bear hug her. So one hand has her nose and jaw kind of holding the mask in place, and the other one is holding the canister after I've primed it and put it in. So once you hit puff, you start breathing in slowly, and then you exhale out. And I personally try to make that first breath large. The way the lungs actually work is like a vacuum. So when you breathe in, you expand the lungs, and so you actually pull some of that medicine, the small fractionated particles of that medicine, deep into the lung tissue, into the small airways of the lungs where they actually need to be. Okay, hold on. Thereafter, you do about 5 normal breaths. And every time you take a normal breath, this little valve will flap. So, you see that? Same thing. You're gonna have this little flap right there. It's an orange little membrane. This little valve is gonna move back and forth. So I actually count that to make sure that my child's taking enough adequate breaths. Good. How many puffs are you supposed to take? It really depends on the medicine, your condition that the doctor is trying to treat, and your treatment plan. So if you're gonna do a second puff now, then after a deep breath, 5 normal breaths, you'll do the same thing again. Puff, deep breath, release, and 5 normal breaths. Sometimes I'll even check in and say, hey, you doing okay? Because taking that deep breath and then breathing out and then taking 5 breaths, you just want to make sure that your child's not feeling dizzy or lightheaded or is still having good technique. They're not getting bored and maybe not taking good breaths, shallow breaths, something like that. All right, now let's talk about maintenance and cleaning your spacer. Now I'll be really honest that they should be cleaned about once a week, and I'm not as good about that. But once you clean your spacer, you will see it makes a huge world of difference in just the overall technique is so much better, because what can end up happening is you can have some of the medicine over time start to stick to the sides of the chamber. So first thing you're going to do is always want to inspect it to make sure there's no cracks, right? You drop it, you break it, may have a small crack in it somewhere. So you'll want to make sure you inspect it visually. Thereafter, you can actually disassemble and break apart these pieces. Now, after you've inspected it, you're going to break it down into different pieces, and then you're going to actually soak it, and you're going to soak it in a mild detergent here. I usually rinse it out really easily. One thing you really want to be careful of, though, is trying not to towel it dry. I know you might think that that makes sense, but that can actually cause static charge, and then it's going to cause more of the medicine to actually stick to the sides. So instead, I shake it off really well and then put it to dry overnight, air dry. Usually I do this at night after I give the medicine to my daughter so that in the morning it's ready to go again. Can you put these in the dishwasher? Yes, you can. However, I do recommend following instructions carefully. You'll want to make sure you're not washing it with very soiled other parts of dishes, because you don't want any kind of debris going into the chamber. I'd also be careful not to put it in a heavy wash cycle, and you might want to be cognizant of how hot the water gets as well. So I talked about when you'd know to replace your inhaler. So once you take it and puff the medicine out, someone's mouth is right here breathing it in. Let's see how much it's gone down. So you should see it at 198 now. That's how many puffs of medicine are left in this canister, and that's really important to keep an eye on so that you know when to replace it. So that's all I have for you guys today on spacers and how to deal with them. I hope this video was helpful. I know that when I first started my child on spacers, it was really hard to find good information. I would find videos, but then they would be from the UK or from Australia. And some of the techniques, while still probably very effective, were not exactly what my pediatrician told me here in the US. So I do think it's very helpful to ask your pediatrician to talk you through it. Go over your technique with your pediatrician. You don't have to necessarily bring the spacer in, but if you'd like to, that's okay. And then let them know that this is how you're doing it. Is that the proper way? One really important thing I want to mention is if this inhaler is a steroid or an inhaled steroid, you're going to want to make sure you keep it followed by toothbrush and rinsing the mouth, because you want to make sure you're washing that medicine out around. I also try to wash the sides of my daughter's face as well, just to make sure, because especially when you have a face mask on, some of the medicine might go right here. I think that's really helpful to know, specifically when it's an inhaled steroid. Now, if you have questions below, make sure you drop them down. I'll do my best to answer them. And if you found this video helpful, make sure you comment as well and share it with someone else. All right, everyone, have a good week. Bye.